About 1 in 30 children spend some time living in care during their childhoods. The government at some point has deemed it unsafe for a child to continue living with their birth family, so they come to live in the care of the local authority, maybe in a residential children's home or with foster carers.
Research says that care-experienced young people can have mental health problems that persist throughout the life course, and they're 5 times more likely to be diagnosed with mental health problems.
There was a really strong alignment between the aim of Grand Challenges in addressing complex, real-world problems, particularly those around mental health and well-being, and that really fit with our questions around how does caregiving make a difference to the mental health of care-experienced people.
There's a lack of research really around the diverse experiences of care-experienced young people. Our research sits within understanding the intersections really around ethnicity, ethnic identity, migration histories, neurodiversity and sexual identities.
Taking an interdisciplinary approach was really important because it allowed us to bring together what we know from psychology, but also what we can learn from sociology.
Our project sought to explore the perspectives of diverse groups of care-experienced young people.
We worked really hard with our partner organisations, Speakerbox and the Care Leaves Association, to think of activities and ways that we could create a space which would allow those conversations to happen.
It was really important that we used tools and methods that were not intrusive of their experiences, but actually enabled them to share in a safe way.
2 examples of activities that we used were body mapping, where we use the body as a way of thinking about caregiving. So how might caregivers use their bodies to support the young people in their care and their mental health? And what impact does caregiving have on a young person's body? And where do they feel that care?
We also used puzzle pieces where we asked participants to write down what they think are the ingredients for good caregiving, and those made up the puzzle.
We got transcripts of the 2 different workshops and then all of the physical data like puzzle pieces and drawings that had been completed at the workshops by participants, and I kind of put them all together to tell a story of the data. A really important theme that came out was that caregiving is really different for different groups of people.
For example, the young Black people we spoke to talked quite extensively about how being a young Black person in care comes with challenges around hair care, food, carers understanding the discrimination that they may face, and responding to racism. So some of those issues surface particularly for young Black people in care.
This project has been a really important stepping stone in helping us secure larger external funding of over £1 million from the Wellcome Trust. Ultimately, what we want is to develop guidelines of what care needs to look like for care-experienced people, what supports need to be in place, and training for the people who are offering that support. It's so important for universities to invest in projects which really align with making a difference where society needs it the most. It's a really important way of giving researchers the chance to do the groundwork that really needs to be done to do huge, impactful work which changes policy and practice for the better.